My name's Alison Dunn, I'm the Chief Executive of Citizens Advice Gateshead. We help over 10,000 people every year with our work, and that's predominantly around money advice, housing, welfare benefits, employment and relationship issues.
My name is Susan Kahn, Professor of Public Health Research here at Northumbria University in the Faculty of Health and Life Sciences, and we've just completed a project that we're really pleased about, and we really think the results will be useful for lots of other people to hear about, and also the process that we did conducting the research, because we were quite innovative, quite ambitious, and we think it would be really useful for researchers and for providers of welfare advice and perhaps even other kinds of advice as well.
We came to Northumbria University with a conundrum. We knew that advice and information was improving the health and well-being of our clients, but we had no way to prove it. All of our evidence was qualitative and gut feeling, anecdotal. So when I was having conversations with commissioners about funding our services over the long term and positioning ourselves as a health provider, I had no real evidence to support what I knew in my gut was the impact of our advice.
Citizens Advice, obviously, because in times of austerity particularly, needed to prove they had value for money and to prove their effectiveness, or at least to demonstrate what levels of effectiveness they were achieving. And that's very much about the kind of work we do here at Northumbria University and in Fuse generally. What we could have done initially was fairly kind of small scale if they had been able to fund it themselves only. But with extra funding, we could do a much more ambitious project. We could draw on a design using realist evaluation methodologies that allowed us to not only try and work out was welfare advice having a positive impact on health, but also why it was having a positive impact, how it was it the context in which the advice was given, was it the way it was given, was it the people who were seeking the advice. So it would allow us to very much more understand the whys and wherefores as opposed to just it did or it didn't.
This particular university is considered to be one of excellence in the field of social evaluation. I had a chance conversation with someone that brought me to this faculty in particular, and after conversations I had with Sue Carr, it was absolutely clear to me that this was the right team to be working with me.
The project started off very informally a few years ago, about 3 years ago, where Alison from the Citizens Advice Gateshead contacted us just to have some informal discussion about could we help them develop their evaluation strategy, and then we started doing that. As luck would have it, at the same time, a call came out from the School of Public Health Research that fitted our topic perfectly. So we collaborated together, developed a proposal, submitted it to School of Public Health, and we were delighted it was successful.
There were 3 projects that were involved in this programme, so the 2 of them were funded by the Clinical Commissioning Group for Gateshead. The first is around providing social welfare advice to support doctors in their work. So GPs get a lot of social welfare issues in their chairs, and whilst that's very valid, it's taking up their time in terms of dealing with clinical issues. The second is a project which is around supporting people with mental health, significant and enduring mental health. That's predominantly around ensuring that those people are able to access their full benefit entitlement. And the third project is one which is funded by Gateshead Council, which is around providing crisis support for people who are maybe at risk of falling out of the system. So one of the reasons why this project has been particularly successful and why we've had such huge success with engagement has really been around the level of trust that there is between those clients who we're working with long term and with their advisors. And that's actually one of the outcomes that's come from the research as well. So we knew there was high levels of trust, but the research has helped us to really prove that that's a key ingredient in engaging with people and being able to help them.
We found that all clients had an increase in well-being and a decrease in stress. So we used the perceived stress scale and the Warwick-Edinburgh mental wellbeing scale. That was explained by 3 different strands of qualitative work which focused on how Citizens Advice increased the capabilities clients had, how they provided a trusting relationship, and finally how they functioned as a buffer between the client and the state. I think especially in this project, when conducting the interviews, myself and the research team felt like there was a lot of hard-hitting stories, and sometimes through traditional portrayal, in research of those stories. It's just use of a quote, and that didn't for us capture the full story. So working with Kappa Pi meant that we could portray those stories a little bit better by using little bits of all of the clients and participants' stories and information. So it meant that there was a more holistic portrayal that made the research, brought it back to life a little bit, made it a bit more real.
Kappa Pi is a theatre company, and we're based in Newcastle, and we've been going for about 21 years now, and we make theatre with lots of different kinds of people, with school groups, with researchers, with community groups, and we're really about getting people to think and learn through theatre.
So we work with Kappa Pi by sharing some of the programme theories that we developed as a research team and that had been tested and refined throughout the research. We shared those theories but also had meetings and described some of the aspects of client stories that they had shared with us whilst remaining anonymous, so that Kappa Pi could take inspiration from that and create their character, who for me rolled all of the clients into one and reflected that really well.
For this project we created a character called Dawn, who's a taxi driver. When the audience first meet Dawn, they see that her home and work life is becoming increasingly complicated and difficult to manage.
Whenever they need me to be anywhere, they just text and I take them where they need to go. They call me Sheila's Wheels, the kids, which is funny because my name isn't even Sheila, it's Dawn. My mum says they take advantage, but I don't mind. Someone said I should go for help, but where? The doctor. Will he pay my debts? An agency? They'll only want to charge me, I know they will. I'm on my own now, well, as good as, especially since Dave got bad. But I work nights and keeps me out of mischief. And then I'm free for all of them during the day if they need me.
So I think using theatre to share this research really just gave another way into that data that the researchers had collected. When we next meet Dawn, it's clear that she's reaching a point of crisis.
So I took out a loan, I know. But if they know that you're in trouble, that seems to make things worse. It's like they can smell blood. Charges on top of fines, on top of fees, and I can't pay, I can't. No matter how much they call or knock or write and call, I just can't.
I felt very emotional watching that performance because as the leader of the organisation, it's fair to say that I try to keep in touch with what's happening with our clients and on the front line, but sometimes you do become a bit detached from what's going on in the real world, and that really hit home to me, the tension and the stress and the way that problems build in people's lives. And I felt very connected to that performance and extremely proud of my organisation, knowing that my staff and volunteers are changing people's lives for the better. It was quite overwhelming.
Yeah, I think it did help people relate, and I think it helped people to remember that this wasn't research that was done in a bubble somewhere. It was research that was integrated in real people's lives. You know, it was hard-hitting stories. These people had difficult times. So I think it really made it real for the audience, and it also helped us in that we could, in our presentation, refer to the character and give examples.
I definitely think that the Kappa Pi film was a fair representation of what clients experience. The data that we get, the statistical information that we get from helping people tells us that they don't come to us with just one issue. There are often several issues which are coming at them all at once. Problems don't turn up in isolation, they turn up in clusters, and it was very obvious from that performance that the pressure in that actress's life, in that sort of portrayal, was building, and I could feel it building throughout the performance to the point where the problems became a crisis.
I've stopped answering if I don't know the number, I don't answer the door, my bag's full of envelopes, I just get to the front door and I grab them. I don't open them, I just carry them around with me until I can find somewhere to bin them.
she was becoming paralysed and things were starting to spiral out of control. And that's a very typical client experience that turns up in our waiting room.
The performance was very well received. On the evaluation forms it was actually mentioned a lot, and they really enjoyed the richness of it.
Tired, I'm not sleeping. I'm doing everything I can to keep food coming in, to keep things looking normal so that the kids don't realise how bad things have gotten.
The questionnaire used in this project is going to be used in different services that Citizens Advice offer. So it was originally used in 3 intensive services. It'll now be used in different services, including, for example, housing advice and debt management services. So we're hopeful that Citizens Advice will continue to use the questionnaire. We've also had links with National Citizens Advice to understand how we can take the research further there.
The final time we meet Dawn in the play, it's after she's accessed Citizens Advice. And this section of the play really shows the benefit that Dawn has had through accessing this service.
I phoned that number, Citizens Advice, just after I saw you, I think. I thought anything was worth a shot. I just went in, emptied my bag onto the table and I cried. All the advice though, I mean, it wasn't a magic wand, but bit by bit they're helping me make changes, just get control.
So the results from this project help me to do my work because they provide an evidence base for something which I've always known and suspected, and that is that advice and information improves the health and well-being of the people that we serve. I would say that I've probably always known that, I've always felt it, and I've had a lot of anecdotal evidence to suggest that that was the case. But this is the first time I've really had any evidence that I can put to commissioners which is robust.
I wonder about us locked away in our own worlds with our own worries. Just trying. How do you do it, said Night. How do you wake and shine? Keep it simple, said Light. One day at a time.